Happy Autism Awareness Month. In today's video, I'm going to share with you 3 tips that you might want to consider if you are trying to manage and heal your child, or if you are an adult trying to manage this yourself. I'm really excited to share with you not only my professional, but also personal experience with autism. Stay tuned for this informative video. Every day should really be Autism Awareness Month because of the statistics that we're finding. It's significant. I think it's really important that we kind of dig into some of the deeper rooted aspects that might be imbalanced in the autism brain. I know autism very well because it hits home. Literally, I grew up in a household where my younger sister would have autism fits and just had all sorts of health challenges. So I know many of you don't know this, and I don't talk a lot about it, but I have a younger sister. She's 2.5 years younger than myself. Her name is Amanda, and she was born with extreme, back then in the early 80s, they called it mental retardation. We don't label it that way, but she was profoundly mentally handicapped. Amanda has been plagued with seizures her whole entire life. And my parents are her primary caregiver. And the research and the awareness in the natural health field has grown just unbelievably. So with that being said, let's dig into either your child's case or a loved one, a student, or even it might be yourself. So autism is considered a spectrum disorder, and there's so many different aspects to it. So I'm going to just speak broadly. I'm not going to get really focused in on, say, Asperger's or the really intense cases like my sister. But I want to dig into 3 tools that you can use to help balance out some of the brain imbalances, some of the chemical imbalances, the toxicity, as well as inflammation. So at the core of what you're dealing with, your child, yourself, your children that you manage and teach at school, what they're dealing with is a lot of brain chemistry imbalances, and specifically neurotransmitters. For all of my patients that there might be a diagnosis or we're on the fence and we're seeing some behavioral issues, sensory issues, testing the neurotransmitters is part of my catalog. This is a huge offering that I provide. It's an at-home test kit. The ease of use is the most crucial aspect. Like, I remember having to go to the hospital to do labs with my sister, and it was awful. It's probably one of the reasons why I hate blood draws and serum draws and labs for that matter. So when we test neurotransmitters, we're actually just testing saliva, super easy to collect, and then urine. And this is what we call dry urine. So the collection samples are not ones where you have to go to a practice. You can situate yourselves at home to easily take the test. Why you want to test neurotransmitters in an autism case is because of the links to neurotransmitter balance and these symptoms like anxiety and headaches, insomnia, mood changes. If you are dealing with a child with autism, you know the mood strikes, the mood changes. They could be fine 1 minute and then they're having a complete meltdown over something that's sensory or food oriented. Fatigue is a big one that we see a lot of young children dealing with, and we're not really quite sure. Changes in blood pressure as well. Insomnia being a big one. Glucose changes where there's blood sugar imbalances, and then just general irritability. Panic attacks and anxiety attacks often will accompany some of the sensory challenges. And what I find is if we can hone in and test the neurotransmitters, we can identify some of the root cause of phobias and varying anxiety disorders by addressing the neurotransmitters like GABA and dopamine and glutamine and histamine, even serotonin. So those are all probably very familiar neurotransmitters. You probably have heard, like, maybe we are dealing with a histamine reaction. Perhaps your child is dealing with hives or major food sensitivities. Histamine reactions, histamine response is related to that. Similarly, serotonin and dopamine levels, those are often imbalanced. Now, there are deeper aspects at play, deeper biochemistry at play, like the adrenals. We can test the adrenals, but with autism, I want to go even deeper into the neurotransmitters, because if we can identify imbalances that are causing the insomnia, then we can balance that neurotransmitter that's kicking off your child staying awake until 3 a.m. in the morning. You're exhausted, they're exhausted, their adrenals are burning out and causing imbalance. They're having troubles at school or at play school or wherever they are. They might also be dealing with anxiety because of that. So if we can identify what that imbalance is, that becomes really crucial. And neurotransmitters are a combination of steroids, hormones, and then also metabolites. And that gets a lot deeper into most of the stuff that you're probably going to hear at your normal pediatrician's office. But it's something that I want you to be aware of, that you can actually test, like a test kit like this. So I'll include links down below. I'm only telling you this information because I think it's quite impactful to dig deeper into resolving imbalances. The second aspect I think that's really crucial is I see a ton of patients with all spectrums of autism diagnoses. They often have sensitivities to chemicals and environmental sensitivities. There might be allergies, there might be mold toxicity or sensitivity to mold. There also might be pretty intense sensitivities to food coloring and preservatives in food. So those are things, if you haven't started to kind of eliminate out or even test, that's a good route to go even deeper, because a lot of times those neurotransmitters and the imbalances there are going to get triggered, like that histamine response is going to get triggered for something environmental. So this is a 3 kind of layered approach that I take when working with my patients. The third and final is CBD. I use CBD to manage inflammation, to manage pain. CBD has wonderful benefits, like for my sister, who is a prime candidate to be using CBD therapy to manage some of the epilepsy and the seizure activity that she has. The other thing that CBD does in the autism world is to help balance inflammation. Brain-oriented inflammation is going to trigger neurotransmitter imbalances. It's also going to trigger and cause greater reactivity to foods, dyes, any of the pesticides, herbicides, insecticides, any of these chemical sensitivities that will calm that reaction down. Now, it doesn't get rid of it, because we actually have to eliminate. But when we're looking at how do we balance the autism brain, we can dig into the neuroendocrine balancing, the brain-oriented biochemistry, and we can dig into some of the inflammation that the cells are dealing with. And that's really a huge part of my practice. So the big question in the CBD world is it legal? How do I use this and dose it for a child? So I will tell you this: CBD, cannabidiol, hemp extract, these are all terms for CBD, cannabidiol. The therapy, CBD therapy, is using a particular type of extracted nutrient from the hemp plant or cannabis plant. They're all the same. It's the cannabis sativa is the name for the hemp plant, and it's, whatever scientific species. I'm not a botanist or biologist. So that name, CBD, cannabidiol, you'll see hemp oil and you'll see extract, CBD hemp oil extract, cannabidiol. You want to dose your child internally and topically. And one of the things that I love is I love reaching for a hemp salve. So Pure Ratios is one of the brands that I love. And it smells really delightful. So there are a lot of CBD oriented oils or balms, topical salve that you can put on the body, and they're mentholy. Now, a lot of children, particularly with autism, are very sensitive to the camphor and the menthol, and that just cools their skin way too much, way too much. So I go very gentle in terms of what I'm going to introduce. And I like to use an herbal CBD hemp salve. This comes from Pure Ratios, and it has arnica, which is topically soothing to the skin. It reduces inflammation and swelling. It also has calendula. Love that. That's marigold. That's another good thing for skin sensitivities, hives, rashes, psoriasis, eczema. That'll also be present with a lot of individuals who are dealing with or have been diagnosed with autism because of the chemical sensitivity, the whole gut imbalance, it's all part and parcel. It's part of the course and it's part of this whole mix of imbalance. So I actually like to blend in some of these salves. Now you can topically put the salve on your child in the morning, at night, whenever. Now obviously most schools, you're not going to be sending them in with a bottle of salve, but you can salve their neck, the carotid arteries. 26 seconds, just like that, is how quick a topical, any type of thing that you put on your skin for that matter, gets into the bloodstream. So if we're gonna deliver CBD topically, 26 seconds is the time frame for it to get into the blood-brain barrier through the carotid artery, and boom, you're getting balancing neuroendocrine, neurotransmitter balancing by using CBD topically. You can do the ingested method where you do several drops, and I have more therapeutic kind of protocols that I'll link down below. Then there are things like these roll-ons. I wish we had smell-o-vision. This smells so, it smells so good. So you can roll on. So for instance, my sister, she still has a seizure disorder. She had grand mal seizures all the time. I mean, it was sometimes like every day. She had petite mals. So I grew up with the panic mode, and part of my adrenal issues, unfortunately, are from that upbringing. But the CBD would have been really impactful for my parents to use back then, because after her seizures, and especially if you witnessed a grand mal seizure, they are just, it's traumatizing. It's going to be hard to not cry, because it's so traumatizing witnessing it and then how their body responds. And so I apologize. This is so close to my heart. So it would have been really, really helpful to be able to smear on, even during the seizure, on the forehead, on the temples, the CBD oil. And again, that whole 26 seconds, some of these seizures last for longer. They're like earthquakes. And my parents would have benefited from using something like this. So this is a 0.35 ounce serum, and it's got the little roll on, and you can roll on anywhere. You can roll on here. Oh, it smells so good. So you can roll on in the sensitive areas like the wrist. You can roll again on the neck. You can roll behind the ear, up around the forehead. This is high dosing. So this is 120 milligrams in this little 0.35 ounces. You get a lot with this. And with that, there's a lot of power. CBD can balance anxiety and a panic attack. It can calm the body. So if you have a child that's really reactive, or let's say school's ending and they're transitioning into a new program, or if school's starting and they're transitioning and there's that transitioning challenges, or even seasonally. And we experience minor degrees of this with Gabriel, in that we're going from winter to spring into summer now, and he wants to wear soft, more warming cotton pants. Well, you can't do that when it's 80 degrees. And so the meltdown minimizing that we have in our family, we're using the CBD hemp oil on his forehead before we get him dressed so that we can calm him down. Similarly, there's a whole bunch of other stuff that we can do. And I work with families all the time. So if that's something you want to do one-on-one, I'd be more than happy to do that. But I just wanted to showcase there are a lot of options in the CBD world. You just don't have to have an oil-based topical that you're holding on your tongue. You can have a lozenge where literally you break this open and it's peppermint. So the child thinks they're sucking on a peppermint, and they're actually getting 10 milligrams of CBD each of these little lozenges, which is pretty amazing. So I wanted to share CBD for you specifically because I don't think a lot of folks are talking to the autism community about CBD. And I obviously want to be transparent and honest. Personally, I really wish we would have had a lot of these tools in my sister's plan, and she still is with my family. It's been now almost, oh my gosh, 39 years. The impact to my family from autism has been great. It has been amazing as the last decade has come around, greater autism awareness, greater communication. And so I'm excited to be a part of that for all of you families here, because we did not have that in the early 80s. And that's actually one of the reasons why we left Georgia originally. I was born just south of Atlanta, and we used to travel into Emory, and there was a genetic department because she has some gene defects. We would travel in to crazy, back then, Atlanta traffic for OT and PT like every day. And so I remember those early days, but part of our move with my dad's work was to offer better resources for my sister in the state of Florida, to which she had amazing programs. So I want to offer this to all of you, families out there, caregivers, teachers. What you do is amazing. So for all of you families, caregivers, parents, I want to applaud you for what you're doing. I know for a fact how much rides on your shoulders. And as a parent now, I have much greater empathy for my parents than I ever did as a child growing up, because I had a lot of anxiety and angst. So I just want to say to all you parents, without getting entirely choked up and sobbing here on my channel, I just want to applaud you for what you're doing as a sibling to now a grown adult with autism and a whole multitude of other challenges. I applaud you for what you're doing. It is not easy work. It is a labor of love and just all-consuming, trying to help your child and balance out your child's body. And if I can be a resource for you, I want to. And so that's why I've put out this video in honor of you all and your children and your families trying to manage the whole cobwebs of autism. So I want to applaud you. Lots of love, lots of healing to you and your family and your children. And I'm grateful for your time. So thank you for tuning in, and I look forward to educating you on our next video. Have a good day.